Be honest, is your hair getting thinner every month? More hair on your pillow, shower drain, or comb? Before blaming genetics, science says low vitamin D may be the real reason. Stay with me, because by the end of this video, you'll understand how vitamin D affects hair, why so many Americans are deficient, and what actually works. Hair loss affects millions of men and women in the United States. And no, it's not just aging or family history. Doctors and university researchers now agree that vitamin D deficiency is strongly linked to hair loss and hair thinning.
Today, we'll cover what vitamin D does for your hair, how low vitamin D causes hair loss, signs your hair loss may be vitamin D related, who is most at risk in the USA, what science actually recommends, no confusing medical words, just clear facts. First, what is vitamin D in simple words? Vitamin D is not just a vitamin. Doctors call it a hormone-like vitamin because it controls many systems in your body. Vitamin D helps with bone strength, immune health, muscle function, hair growth. Your body gets vitamin D mainly from sunlight, certain foods, supplements when needed. How hair grows? Very simple. Hair grows from tiny structures in your scalp called hair follicles. Think of follicles like small factories. For hair to grow, these factories need oxygen, nutrients, and proper signals to turn on. Vitamin D helps send that turn on signal. How vitamin D affects hair? Science explained simply. Research from Harvard University and dermatology journals shows that vitamin D plays a role in activating hair follicles. When vitamin D levels are healthy, hair follicles stay active, hair stays in growth phase longer, shedding stays normal. When vitamin D is low, hair follicles become inactive. Hair enters resting phase early, more hair falls out than grows. This leads to hair thinning, slow regrowth, diffuse hair loss, hair falling from all over. Why vitamin D deficiency is so common in the USA? Doctors say vitamin D deficiency is one of the most common deficiencies in America. Here's why. 1. Lack of sunlight. Many Americans work indoors, drive everywhere, avoid the sun. Your skin makes vitamin D from sunlight. No sun equals low vitamin D. 2. Heavy sunscreen use. Sunscreen is important for skin cancer prevention, but dermatologists explain constant heavy sunscreen use blocks vitamin D production. This doesn't mean avoid sunscreen, it means balance matters. 3. Indoor lifestyle. Office jobs, remote work, screen time. Modern life keeps people inside, away from natural sunlight. 4. Geography and seasons. People living in northern states, areas with long winters, produce less vitamin D for many months of the year. 5. Diet low in vitamin D. Very few foods naturally contain vitamin D. Most people don't eat enough fatty fish or fortified foods. Signs your hair loss may be from low vitamin D. Hair loss from vitamin D deficiency usually looks like hair thinning instead of bald patches, hair shedding all over the scalp, slow hair regrowth, hair loss with fatigue or low energy. Doctors often notice that people with hair thinning, chronic tiredness, frequent illness have low vitamin D levels. What science says? Real research, simply. Multiple studies published in dermatology journals found people with hair loss often have lower vitamin D levels. Hair thinning conditions are linked with deficiency. Correcting deficiency may improve hair shedding over time. Important truth, vitamin D is not a magic cure, but it supports healthy hair growth. Vitamin D is not the only factor. Doctors are clear about this. Hair loss is usually multifactorial, meaning vitamin D, iron, stress, hormones, genetics all play a role. But vitamin D is often the missing piece. Food sources of vitamin D, science approved. Vitamin D foods include fatty fish, salmon, sardines, egg yolks, fortified milk, and cereals. Doctors agree, food alone is often not enough to correct deficiency. What about vitamin D supplements? Doctors recommend testing before supplementing. Why? Too little causes problems. Too much can also be harmful. Vitamin D is fat soluble, meaning excess is stored in the body. Can too much vitamin D cause hair loss? Indirectly, yes. Excess vitamin D can raise calcium levels, which may disrupt hair growth cycle and affect scalp health. More is not better. Balance is better. Should you test your vitamin D? Most doctors recommend a simple blood test if you have unexplained hair loss, fatigue, bone or muscle pain. Testing helps avoid guessing, prevent overdose, and save money. How long before hair improves? Hair growth is slow. Doctors say shedding may reduce in 6 to 8 weeks. Visible improvement takes 3 to 6 months. Consistency matters more than speed. Biggest mistakes people make: taking supplements without testing, expecting instant hair regrowth, ignoring diet and lifestyle, using only shampoos and oils. Doctors remind us hair loss starts inside the body. Vitamin D versus genetics, a reality check. Genetics influence hair sensitivity, but research shows vitamin D deficiency can worsen genetic hair loss. Supporting your body may slow progression, improve hair quality, support remaining hair. Simple action plan, safe and science-based. 1. Get sunlight safely. 2. Eat vitamin D-rich foods. 3. Test vitamin D levels. 4. Supplement only if needed. 5. Be patient and consistent. Quick summary. Vitamin D supports hair follicle activity. Deficiency is common in the USA. Low levels can cause hair thinning. Testing is smarter than guessing. Balance beats overdose. If this video helped you understand vitamin D and hair loss, please like. It helps spread science, not myths. Subscribe to Health Secrets Explained for simple, science-based health content. Comment below, have you ever tested your vitamin D levels? Next video, vitamin D deficiency symptoms you should never ignore. See you next time.